Hello, so today we are going to be assessing my patient's GI system, renal system, and musculoskeletal system. So I'm going to go ahead and start with the GI system. So if you don't mind, could you just go ahead and lay down for me, okay? All right, and is it okay if I just raise your shirt up a little bit?
Yeah, that's fine.
Okay. Okay, so on inspection, I don't see any scars, no pulsations are noted. I don't see any lumps, masses, anything like that. Everything looks symmetrical. It looks normal for what this patient, what I would expect this patient to have. Okay, so I'm gonna go ahead and I'm gonna just listen to your abdomen, okay? And I'm just going to listen for bowel sounds in all four quadrants. Okay, so bowel sounds can be heard in all four quadrants. They're not hyperactive or hypoactive. It's within normal limits. And I'm also going to listen for any bruits as well. And no bruits can be heard over the major arteries. So I'm going to go ahead and perform percussion just to identify where the liver is. So sorry. I'm just going to touch your abdomen here, okay? Okay, so the border of the liver is dull. I can feel where it is at. And one last thing I'm going to do real quick is I'm just going to touch your abdomen if that's okay. All right, just let me know if you feel any pain at all, okay? So you didn't feel any pain? Okay. No pain is noted, and I cannot feel any masses, pulsations, nothing like that. So if you don't mind, could you go ahead and sit back up for me? We can pull your shirt down, okay? And if you could just like sit up a little bit so I can get to your back. I'm just going to be feeling, you just let me know if any of this hurts, okay? Did anything hurt back there? Okay, so there is no flank pain, and there isn't any renal abnormalities that me and him talked about. So the last thing I'm going to do is inspect the musculoskeletal system. So if you don't mind, could you just hold out your arms for me? All right, so I'm just looking at the joints, and I see they're symmetrical on each side. There is no abnormalities, no contractors or anything like that. They are symmetrical. They're not hot to touch. There's no sign of redness, swelling, anything like that. And then there is no deformities of the joints or bones. And you haven't ever had any trauma that changed the shape of your bones, correct?
No.
Okay. Alrighty. And one last thing we're going to do. So off video, we did range of motion activities for the neck, shoulders, wrists, spine, hips, knees, and ankle. And he was able to have full range of motion, and it was active range of motion. And now on video, we're going to go ahead and perform a range of motion exercises on his elbows. So if you could go ahead and just put both elbows out in front of you, or both arms out in front of you. And if you could just raise them up towards you and raise them back down. All right, and then could you flip them over like this? All right, so it appears that he does have full range of motion of his elbows. He was able to perform flexion, extension, pronation, and supination. So as far as risk reduction and health promotion tips, one of the things I want you to focus on this week is to just make sure that if you ever have any abdominal pain, you notice anything different with your abdomen, like any masses, any changes at all, please go to the doctors or the emergency room and get those checked out, because those can lead to some pretty major complications. Also, to promote good urinary health, drink lots of water, limit caffeine. We really want to make sure we're flushing out your kidneys so that you're eliminating all the waste that your body doesn't need. Also, try and perform as much exercise every day as you can, whether that be something light and small, such as, just like a 20-minute walk, or all the way up until, going on runs, going to the gym, playing basketball, anything you like. It will be beneficial to, making sure you don't develop things like arthritis. It's good for your joints and your bones, and it promotes muscle strength. Another thing is to try and reduce the amount of sodium you're taking in every day. Sodium actually makes your body retain water, and that can be difficult on your kidneys. And one last thing is to take a daily multivitamin. Multivitamins are going to help promote many different things, but among those is good bone health with the vitamin D. And then, having good intake of calcium with, milk and different fruits and vegetables is also good as well. So today we assess the GI system, the musculoskeletal system, and the renal system, and everything appeared normal for this patient, and we will move on to next week.